Welcome, everyone, to the webcast series, The Public Health Insider. My name is Casey Farm, and I'm the Director of Alumni Relations for the College of Public Health and Human Sciences. I'm absolutely delighted to introduce our moderator for today's episode, Manage Your Growing Everyday Stress. This is the second of the fourth season of the Public Health Insider series. You can register for any episode or watch any episode from the previous seasons at osualum.com/public health webcasts. A couple of logistical items first. If you look at the bottom of your screen, you will find a Q&A chat button. If you're a regular to this series, this is absolutely familiar to you. You are welcome to type questions throughout any point in time during today's talk. And at the end of the presentation, our panelists will answer as many questions as they can before the end of the episode. So you can ask them now, or you can ask them during the live Q&A portion. Our webcast series is hosted by the OSU Alumni Association in collaboration with the OSU Foundation, the College of Public Health and Human Sciences, and the OSU Center for Health Innovation. We are stoked to return this series for its fourth iteration surrounding public health, what it is, why it's important, and how it applies to our lives and our communities. For more information on public health and all the other incredible work that's being done in the college and the human sciences, visit health.oregonstate.edu. Now on today to our moderator, who will introduce our panelists. Our series moderator is Dr. Allison Myers, and she is the director of the OSU Center for Health Innovation in the college. The center serves as the connector between external organizations and Oregon State University faculty in the discovery of innovative solutions to pressing health and wellness issues, and builds workforce capacity in public health and human sciences. In service to meeting the most pressing public health needs in the state of Oregon, the center is home to projects related to the COVID-19 response, including Trace OSU and Trace Community. They're also working on mental health promotion and substance use prevention in rural Oregon, and improving food security for the Oregon Health Plan members through store-based changes. It is my absolute pleasure, as you can see on your screen, to introduce and reintroduce to some of you and turn the webcast over to Dr. Allison Myers. Dr. Myers, a pleasure to have you as always. Thanks for being here.
Thank you, Casey. Hi, everyone. Today we're talking about stress. And I don't know about you, but the pandemic has been, it continues to take its toll. When we look at population level data, an alarming portion of us are saying that, I may be near a crisis. And so I think as we start today, I would invite all of you, as I often do, to get comfortable, take a pause. This is not your average Zoom call. Many of us are on Zoom all day, every day. This is a different type of Zoom call. So grab your tea. For me, I've got Topo Chico with a little herbal tea in there. And we're going to get on with the show. We have three amazing faculty members today. I'm going to introduce them all. They're each going to give 3 short talks. And then we hope to have a really robust Q&A. And the take-home message, the big lesson, the big insight for today is that I hope each of us can leave our time together a little more prepared to continue to take on the stresses and the challenges of everyday life in Oregon, in America today. So I'm going to invite Carolyn, Karen, and Heidi to please turn on your cameras. I'm going to introduce the 3 of you, and then when I'm done with that, I'm going to turn it over to you, Carolyn, because you'll be going first. Thank you again so much for being here. First, we have Dr. Carolyn Aldwin. You'll say hello. Carolyn is the Joanne Leonard Director of the Center for Healthy Aging Research and Director of the Gerontology Program, and a Professor of Human Development and Family Sciences in our Oregon State University College of Public Health and Human Sciences. Dr. Aldwin, you did your doctorate in adult development and aging at UC San Francisco, and were a postdoc at UC Irvine. And before coming to Oregon State, you were a professor at UC Davis. And you have, you're busy and productive. Dr. Aldwin has served as president of the Adult Development and Aging Division of the American Psychological Association, and is currently president of the Society for the Study of Human Development. Carolyn, we're so glad you're here. Thank you so much for being here today. We also have Dr. Karen Hooker. Karen, say hello, wave at least. Professor Karen Hooker, you came to Oregon State in 1994 and have held a lot of roles, a lot of leadership roles in our College of Public Health and Human Sciences. At one point, you were the director of the program on gerontology, interim department chair for human development and family sciences, founding director of the Center for Healthy Aging Research, and the Joanne Leonard Peterson Endowed Chair in Gerontology and Family Studies. You earned your master's degree in psychology from the College of William and Mary in Williamsburg, Virginia. I'm a native Virginian, feel like I have to admit that now. And a PhD in human development and family studies at Penn State, which is my undergraduate alma mater. Karen, Dr. Hooker, thank you so much for being here today. And our third panelist is Dr. Heidi Igarashi. We're so glad you're here. Thank you for waving. You did your doctoral studies here in human development and family studies from our College of Public Health and Human Sciences here at Oregon State. And Dr. Igarashi's work focuses on the intersection of resilience, optimal aging, and wisdom. So when I offer that, I hope all of us leave here today a little more resilient and a little better able to cope with stresses, I think we have the right set of panelists. Heidi, your research interests are an extension of your 26 years as a mental health counselor and your current role as a caregiver to your mother with vascular dementia. You've co-authored and authored lots of professional journal articles, book chapters, and a book on stress, resilience, optimal aging, wisdom, and intergenerational relationships. Dr. Igarashi is a courtesy faculty member at Oregon State and also serves on the board of directors of the Grace Center for Adult Day Services, which promotes community-based approaches that facilitate resilient aging in both caregivers and care recipients. You all, thank you for letting me introduce you. I'm thrilled to turn it over to you all. Again, Carolyn, you'll share your screen and we'll all keep our cameras on. We're gonna do 3 short talks. For those of you in the audience, bring your questions as you think of them. You can use the Q&A button and send them in, and we hope for a lively discussion. Over to you, Dr. Aldwin.
Thank you very much for helping to organize this and for the lovely introductions. It's going to be an interesting talk, and we're going to cram a lot of information into a very short period of time. So thank you so much for joining us today. So I think it goes without saying that the COVID-19 pandemic is really very stressful. Why? Because it's both a trauma, a very serious life-threatening stressor, and a chronic stressor. It's been going on far too long. I think everybody is in agreement about that. We're all ready for this to be over. But it's really clear in surveys that COVID-19 is a significant stressor. American Psychological Association did a survey and found that nearly 8 in 10 people say that the coronavirus pandemic is a highly significant source of stress in their lives. And nearly 7 in 10 said they experienced increased stress over the course of the pandemic. So you're not alone in feeling stressed out. And we also know that it has adversely affected mental health, that a survey done in January of this year compared the results from a couple of years ago. And in 2019, 15% of people surveyed, this is a national survey, had anxiety or depression. In 2021, 44% had anxiety or depression. So it's more than doubled. And, you know, we think about it in terms of the elderly and they're under social lockdown and they're socially isolated and things like that. But when they looked at who had mental health problems, it was the younger adults. The Gen Z adults are 46%, the Gen Xers 33%, and as well as the millennials. The boomers at 28%, but the older adults were only 9%. right? So it's the younger people that are having a more difficult time coping. And if you look at loneliness, about half of US adults said they'd felt very lonely during the pandemic. But again, it's the younger adults, the Gen Zers and the millennials, who are having a lot of difficulty. And it's really the older adults are only 20%. So this is taking a big toll. And again, these are community residing people. So we're not talking about folks in nursing homes, who are also having a very difficult time. So we were interested about whether or not the lockdown led to problems among older adults. And we sent a survey to the Life Registry members early on. And we got about 247 folks, 74% women, which is normal. The mean age was 71, and they ranged from 51 to 95. Privilege sample, 88% white, 3/4 had college or a post-bac degree, 72% were married, and only 22% lived alone. So the interesting results was that most people complied with the lockdown and used everyday protective activities like masking and hand washing and things like that. But these were not related to the psychological, cognitive, and physical symptoms that our sample reported. What was? Vulnerability factors, pre-existing loneliness, perceived stress during the pandemic. But there are protective factors as well. So providing support to others were less likely to have problems with their mental health or cognitive health. And resilience was especially important. It's a self-report measure talking about being able to bounce back from stressors. We presented this last year and we're in the process of writing it up for publication. So the question is, why are the older adults doing so much better? Well, we know from earlier research that older adults appraise problems as less stressful than do younger adults. Having a lifelong perspective on problems really helps. Older adults are often better at emotion regulation. They focus more on the positives and just forget the negatives. They also focus on promoting long-term relationships. So they're less likely to get bent out of shape over a smaller everyday problem, but really try to focus on what's important long-term in the relationship. And finally, they do more proactive coping. They anticipate problems and act to prevent or mitigate negative consequences. Whether that's simply, gassing up the car before you go on a trip, right? So you don't run out of gas in the middle of the night. Or making hotel reservations ahead of time, or making certain, you leave 3 hours early to go to the airport just in case something is wrong. But the idea is that it's much better to try to avoid problems than having to cope with ones once you have. But of course, we all have problems that we have to cope with. And the caveats to our study is that we looked at well-functioning, high-resourced adults. And those with greater vulnerabilities may have more difficulties. We all have seen pictures and maybe done it ourselves, waving to our parents and grandparents in nursing homes. And the institutionalized older adults were especially affected by social isolation. There have been studies showing that folks with dementia were especially affected. They, can you imagine being approached by people in moon costumes and having no clue of what's going on? And the other thing I think is to remember that there's no silver bullet in coping. Coping is individual. You change as a function of the situational demands. What works for one person may not work for another person. So you have to know yourself. But there are some general stress management tips I can share with you. Breathing. Breathing is incredibly important. When you are anxious, for example, you breathe very shallowly from the top of your chest, and that actually changes the pH of your blood because you're not getting rid of the carbon dioxide. So if you breathe deeply from your belly, that actually can decrease your anxiety through changing the biochemical properties of your blood. Exercise. There's been countless studies showing that exercise is one of the best ways to prevent or mitigate anxiety and depression and stress. I love the Japanese term Shinrin-yoku, nature bathing. Again, a lot of research showing that just being out in our beautiful nature decreases stress levels. Focus on the positive, like older adults. Every situation has good and bad about it. If you can, you don't ignore the negative stuff because you may need to know about it. But younger people dwell on negative stuff, older people dwell on the positive stuff. Mindfulness, be aware of what you're thinking and feeling and why. And if you find yourself with negative thoughts, like this is never going to end, or I'm never going to get a job again, or, my kids are going to be totally messed up, just remind yourself that this too shall pass. Be aware of your body, where you are in space, what's around you. But most importantly, you need to have compassion that, everybody's stressed out, everybody's anxious and irritable, everybody's exhausted and late on everything, right? And so you just, it's COVID is great because you can just say, COVID, sorry, I'm late, right? But you need to have compassion not only for others, but especially for yourself. Don't insist on things being perfect. This is a rough time. We're all in this together. You just have to hang in there and support each other. Thank you. So I'm going to turn it over to Karen Hooker now.
Okay, thank you so much, Carolyn. Lots of great tips there for stress reduction. I'm going to be talking about personality, and although I'm not focusing specifically on COVID-19, an interesting question I'd like those of you in the audience to consider is, to what extent, if any, do you think your personality may have changed during the pandemic? And if so, do you think this had any effects on your health? Next slide, please. Great. Much of what we know about health has focused on the lifelong importance of health-related behaviors, things we all know, like not smoking, exercising, building your strong social networks. A contributor to health that gets, I think, too little attention is personality. I argue that personality is really a lifespan compass for health because it is our internal guide to navigating our lives. Personality is a very broad construct that encompasses what a person is like, as well as processes that continually shape who we are. Most of us know about trait aspects, like how gregarious you are, how well a person handles stress. But personality is also much more than this. It includes our need to feel in control over certain situations and how likely it is that we will be able to enact our goals. It even includes our life story. However, in this limited time today, I'm going to focus on personality traits because we know a lot about how traits are related to and can shape stress in our life. The traits that are listed here are often called the Big Five, and they're easy to remember because of the acronym OCEAN, which is taken from the first letter of the 5 traits. We're not all or none on these traits. In fact, consider where you might fall on the trait continuum for each of these. Openness to experience describes someone who delights in seeking new experiences, is curious, imaginative, and tends to be artistic. Conscientiousness is how organized, goal-driven, efficient, reliable, and industrious you tend to be. Extroversion is how sociable, assertive, and energetic you are, and it's often contrasted with introversion. Agreeableness is how sympathetic, forgiving, compliant you are towards others. And neuroticism is the extent to which you are or are not emotionally stable. People with high neuroticism may be anxious, worry a lot, are easy to anger, can be hostile, moody, and do tend to get depressed. Next slide, please. The point of this slide, I'm not going to spend a lot of time on it really, is to just show that there's a wealth of research that traits do predict consequential life outcomes. Just 2 examples, conscientiousness and extroversion predict longer lives. Marital status is predicted by people who are relatively low in neuroticism and have higher agreeableness. Next slide, please. Okay, well, researchers used to think that personality was very stable over our whole lifespan. And because of this, personality wasn't really considered a viable target for public health interventions. This idea is no longer accepted as true. Data from several longitudinal studies document changes in personality traits traits across the whole lifespan. And in terms of traits, that's good news for us because we tend over time to become more conscientious, somewhat more extroverted, more agreeable, somewhat less open, and are more emotionally stable, so have lower neuroticism as we age. There's growing evidence that traits can be changed, which is important because traits shape how we appraise and experience stress. So it's an upstream variable. Over time, it relates to the many real-life consequences on that slide I just showed you. For example, short-term interventions have been shown to change conscientiousness, which has downstream effects on many health behaviors, such as exercise, as well as adherence to medical regimens. Next slide. In my research to understand how personality affects stress, I chose to study spouse caregivers of people with dementia because they are universally understood to be dealing with stress in their daily lives. And caregivers are also at high risk of depression and having their social networks erode over time. I hypothesized that personality would directly and indirectly affect mental and physical health, and I also thought it would affect social support. Next slide, please. Just go ahead, just get it all up there. I think oh, there you go, perfect. Well, there are as many contexts of caregiving stress as there are caregivers, because depending on who you're caregiving for, whether it's a spouse, whether it might be a parent or a parent-in-law, and we're all at different points in our lives and have different situations that we're dealing with. There can also be stress proliferation, where stress in the caregiving domain generates stress in other domains, such as maybe financial stressors come about because maybe the medical bills start rolling in, or perhaps not having enough time to spend with your friends or maybe even with your own children can be quite distressing for a caregiver as well. However, I would say that the extent to which you can frame experiences positively and imbue caregiving tasks with meaning, you'll be better for it. One of our studies showed that if caregiving was a part of identity, you were less likely to be depressed. My research has shown that personality traits of neuroticism and optimism were directly and indirectly related to health. Caregivers lower in neuroticism and higher in optimism had better coping skills, stronger social support from friends and family, and in turn these were shown to be related to better mood, less depression, and better physical health. Next slide. Thanks. I included social support in my studies because of a very strong body of evidence that shows that it is also linked to health and mortality. Strong social support buffers the effects of stress on our immune system, cardiovascular disease, and even mortality. Personality plays a role in how people form and maintain relationships. For example, if someone was often moody and hostile, in other words, somebody with high neuroticism, probably not a person that a lot of people want to hang out with for very much time. So they may have somewhat impoverished social networks. Research confirms that it is how we perceive our social support that matters. If you feel lonely, even if you objectively have lots of people in your network, that's what matters. Interestingly, research has shown that friends have been shown to be as important, if not even more important than family for psychological well-being. Last slide, please. So in sum, I hope I've convinced you of the importance of personality, our lifespan compass for healthy living. It is an under-recognized, but I think very important aspect to include when considering stress, because it shapes how we appraise stress and is predictive of important buffers of stress, such as social support. So Dr. Igarashi is now going to talk to us about how to build resilience. Thank you.
Thanks, Karen and Carolyn. And if we can go to the next slide, the first slide. Okay. I get the happy job of talking about resilience, and we're going to share some definitions, give you a few examples of what we saw from our COVID-19 study with resilience in older adults, and then finally, of course, offer some suggestions for how to build and improve your own resilience. Next slide. So definitions. So in the early days, a lot of the work in resilience was around children. And what we were looking at was primarily, there are two key features, that there was a threat and there was some kind of recovery, of bouncing back. And current ways of thinking about resilience go beyond that in terms of being able to sustain a sense of purpose, goal-directedness, and meaning during and after the threat event. And as Carolyn mentioned earlier, the COVID-19 pandemic has been so many types of threats in terms of, it seems to be unending. There are these critical points probably in each of our lives where there was a special poignancy, and consequently, being able to sustain a sense of purpose throughout has been, we're not even to the after part, are we now? The ability to have positive experiences during a crisis was something that was also found, especially in older adults. And I think both Karen and Carolyn have mentioned this. And finally, another aspect of resilience is this ability to evidence by personal growth. We found in a different study, an earlier study, that difficult situations can really shake up your worldview. And in that is the opportunity for individuals perhaps to come to some greater self-understanding, compassion, and acceptance of uncertainty and the complexities of life, all things related to wisdom. Okay, next slide. So although we tend to think and talk about resilience as an individual, an aspect of an individual, and as Karen mentioned, very much influenced by things like personality, resilience also depends on a person's social ecology, their relationships within their communities, and even larger societal influences such as policies that impact and influence the resilience of individuals and their communities. One of the quotes I like best in thinking about resilience is that resilience rests fundamentally on relationships. And when I think about that, I think about both those proximal, near people near us, but also these relationships within our community, more distal. Next slide. So we recently published a paper, a qualitative paper, based on, as Carolyn had mentioned, a survey that was sent to participants in the Life Registry. And I want to give a shout out to everybody who participated in this study as well as others. We really appreciate you because it helps us. It helps us. It helps us all move forward in understanding. So in this study, we used just the qualitative, two qualitative questions, two survey questions, and let me read them to you. One question we asked was, during the past week, what was the most difficult thing about the COVID-19 situation? Almost nearly all participants responded to that question. The second question was, during the past week, did anything positive occur? Pardon me. Did anything positive come about because of the COVID-19 situation? And if yes, explain. And 63% of our of the 221 responses that we use for the qualitative work responded to that. When we, a natural question is, well, why did so many fewer people respond to the positive question? And I think that, there are several possibilities. One of them was well, we explored a few possibilities, whether people were younger or they were still working, health conditions. And what we found was that actually age and health, self-reported health, were not significantly related to whether or not you answered provided a positive response. But whether you were still working was slightly significant. Okay, let's move on to the next slide. All right. As suggested by one of the definitions of resilience, Ong's definition of resilience, a positive statement was seen as an example of resilience. And here, I just want to share a few of the things that we found through our coding. And the majority of the people who responded positively, almost half the responses were on the personal level, and many of these things will look very familiar to you. Everything from keeping busy to doing something new. We had people gardening for the first time, baking bread, of course. Some of the interesting ones were people who were just simply happy to stay home and enjoy the freedom of simplicity from being home. While they were home, they were able to focus on things that perhaps they never had time to do, health, wellness, nutrition. And for some, this increase in self-awareness, experiencing gratitude, appreciation for the people around them, and a few talked about financial benefits. Next slide. Okay. So, respondents also talked about interpersonal and societal level positives. And this was interesting to us because it was, of course, interpersonal. That's a very important thing in resilience. But we were a little surprised that people did also identify societal level issues that provided them with a sense of positive social optimism about awareness, about social justice, about an improving environment. This feeling of community and global solidarity. All right. And next slide, please. So I want to share this quotation, and if you'll bear with me, I'm going to read it because the special thing about this particular quotation by one of our female respondents in her mid-80s is because it sort of captures the different forms of resilience, bouncing back, personal growth, her experience with positive emotions from the personal, interpersonal, community, and societal levels. And I want to remind you that this was not a face-to-face interview. This was what the person had typed into the survey. My only fear was of dying on a ventilator without anyone who loves me nearby. I no longer fear that because this experience has allowed me time to consider all the good things that are happening. People are reaching out to one another again in ways that they had forgotten about or never experienced before. When I see pictures of cities that are beautiful again because the air has cleared and it is no longer contaminated, perhaps when others see it too, they will take global warming seriously. The young people are beautiful examples of making the best of bad times. Quite beautiful. Okay, next slide, please. So, to wrap up, here are a few suggestions for building your resilience, and these are overlapping in fact with some of the things that Carolyn had talked about. The first one, and I think the most important one, is build your connections. There's research from situations following disasters that the more connected you are, the better your survival, the better your chances of survival. It makes intuitive sense. Connect with people who you feel good with when you're with them. Reach out to neighbors, join a group, create your own group of walking with friends and neighbors. Second thing, foster wellness. And what you're building is you're building this reservoir of health, for tougher times. Work on your physical as well as your emotional, because they're both tied together. Nutrition, exercise, journaling. Carolyn and Karen had both mentioned some of these things. And related to this is, I think, what Karen had talked about sort of knowing yourself, get to know yourself. The third one, finding purpose. This sounds like a very tall order, and I think we can talk for a long time about that, but I want you to think small, think simple. What matters to you? Slowly and intentionally explore what really matters, and then begin to weave this into your life. Embrace healthy thoughts, and this is another one we can spend an entire session exploring. Begin to recognize how you deal with change, challenge, and a lack of control. Mindfulness training is a great way to learn how you think and how to shift yourself into a kinder way to see yourself and the world. And what's not up here is actually the last one. Seek the help of professionals or experience others as a way of gaining more knowledge about yourself and insight. Okay, thank you. And the next slide. A last pitch for the Life Registry. Again, thank you all, and we invite people who are interested in helping us register. Follow that link, and I think the only requirement is that you are 50 years old. Is that all? Okay, 50 years and older, and we welcome all of you. All right, thank you.
Panelists, thank you all so much. If we were in a room, we would be sure to offer a warm round of applause. And we have some really excellent questions that are coming in various places, from folks who pre-registered, from in the chat. And so let's see, where do I start? Let's take one from the Q&A. We'll start here. This one says, we spent the last year learning to work and go to school remotely, and many of us learned that it works for us. I'll admit that I'm one of those people. In fact, we have anxiety about returning to normal. We've learned that the traditional 8 to 5 gig doesn't really support good mental health or a close family life. So what are employees and employers to do? Is there any sign of the workplace evolving as a result of the pandemic? I'd love to hear from all three of you on this. I'm not sure who wants to go first, but what's your advice for us as we try to think about going back to normal and what may be changing as a result? How about Heidi?
The pandemic's changed everything. And we're not going to have the exact same setups. I know that workplaces have changed. We've heard many workplaces now are going to allow a lot more flexibility in where you work, because it's fine. People are finding that they're very productive even when they're home. So I think that's really going to be a positive change that comes out of this pandemic.
Thanks, Karen. Heidi, you wanted to add something?
Yeah, I think this is where we have to be maybe a slightly different take on this question. We have simply spent over a year getting used to a different way of living, and now we are maybe being asked to go back to something else that is no longer so familiar. And so I think we need to be very kind, gentle, easy on ourselves as we reemerge and figure out where is it that, how much do we want to do? How much do we want to socialize? And deliberately make those choices if we can.
And you also have to understand trade-offs. So I saw a study that showed that people who work at home were indeed more productive, but they were less likely to get promotions, because a lot of promotions rely upon relationships, formal and informal, and also being in the know. So, there's a lot of information flow that happens around the proverbial water cooler or the coffee bar or things like that. And so that's one of the benefits of being around other people. And so I think I prefer to work at home in many ways, but I really miss interacting with my students. And so hopefully we can get some sort of flexibility and so that we're not, in the rat race of an 8 to 5 job with an hour commute every day.
Yeah,
And just wanted to follow up by saying that I think many of us have realized how crazy our hectic schedules were. Even when I consider all the travel that I had scheduled and had to have canceled, I'm looking back now going, I will never, ever be that scheduled again. I love having time to savor experiences. So maybe we'll get to a good mix.
makes me think that maybe, right, that what is this normal, right? And how about it, that it will be a new normal with some balance of, for those of us who are lucky enough to be able to make decisions, right, about how much time we spend at home, how much time we spend in the office. Feels like it's an important time to talk with your supervisor to, figure out what works for you. What are you missing at the office? Thank you all for your thoughts on that. Here is another question, and this one is for Dr. Hooker. And I want to have you elaborate a little bit as well, because I was listening to your talk and I was thinking to myself, well, I really don't think I'm hostile, but I would like to be more agreeable and less neurotic and more open to experiences. And so I'm wondering, how do we do that? I think some of the resilient strategies, stress and coping. So that was sort of my question, but here's a really good one in the Q&A as well. For Dr. Hooker, are there any interventions known to reduce Big Five neuroticism? You mentioned there were some to increase conscientiousness. So maybe this will, I see Heidi and Carolyn are nodding as well. So let's first go to Karen and then we'll go down the line. What do we do to improve our personality traits?
Well, the good news is you heard my lecture on if you just age, some of this is going to get better, right? But personality and health interventions, it's really an emerging area of research right now. It's still pretty new. And what we're finding is that people are coming up with ways to sample experiences throughout the day and help and give people kind of just-in-time interventions through their cell phone, for example. Very innovative work. It's really quite fascinating. And for neuroticism in particular, because we know that one is, there's a lot of negative things that go with neuroticism. There are I would say interventions, maybe even traditional interventions on facets of neuroticism. Like we know there's anger management programs to help people manage their anger better, stress management programs. People in very high neuroticism get nervous so easily. They have a lot of anxiety about things. And there are traditional methods for dealing with anxiety. So those are some of the facets, but the whole bunch of neuroticism, I haven't yet seen a well-designed experimental study on that, but I'm sure it's coming because it's happening with some of the other traits. And I'm sure neuroticism will be one where it will be happening too.
Thanks so much, Karen. Heidi and then Carolyn, thoughts on this?
Sure. Actually, my very quick answer is that many of the mindfulness training programs provide both they should provide both the meditation component and the help with adjusting how you view yourself within the world. And for those people out there who want to just jump right in and are very open and want to jump right in and do something regarding their personality, this is a good place to start because there is some self-acceptance about sort of where you tend to go. And that's a good first start, and mindfulness training will help you to experience that.
I agree. And also, there's a lot of emotion regulation intervention programs, especially in kids, that usually, rest on 3 legs, one of which is recognizing what you're feeling. A lot of people don't realize that they're angry until they find themselves, snapping at their kids or something like that. And then divorcing that feeling from behavior. So just because you're angry doesn't mean you have to yell at the checker, right? And the third thing then is to substitute, other behaviors. So, if you're standing in line and you're a patient, you've got an appointment you're getting into, and this poor woman is having a terrible time, being compassionate towards her, that she's having a terrible day. And something, we've all been there. We've all had days where, nothing goes right, and not to take things personally. And the other thing is cognitive behavior therapy, CBT, right? That's a really good way. It focuses on stopping negative thoughts, and especially rumination. Oh my God, things are terrible. I'm never going to get out of this. This is never going to work, blah, blah, blah. And it gives you, a lot of tools for just saying stop, or saying, okay, I'm allowed to worry from 8:15 in the morning to 8:30 to 8:30 in the morning, and then 8:15 at night to 8:30, right? And so there's ways you can learn to increase your self-knowledge, right? To decrease the negative things about yourself that you want to change, to personally integrate, and then to self-transcend for wisdom, to have a purpose in life that is bigger than yourself, right? That can give you greater perspective on the little niggling things that drive us nuts every day and their relative importance.
You all are so wise. One of the things that this reminds me of, one of my favorite meditation teachers is Sharon Salzberg, who I recommend to folks in the crowd. But she teaches loving kindness metta meditation, where you're repeating these phrases, and she encourages folks to repeat them anytime they're waiting for something, right? So whether you're sitting at a traffic light, or sitting on the subway, or waiting for the Zoom meeting to start, or waiting for someone to stop talking, or any of those times, and it can really shift your perspective, right? Because you're introducing positive thoughts, right? Rather than, I think, like, based on what I've learned in the last 40 minutes from you all. Thank you for that. We're getting a lot of questions, and this is the problem with these series. They're so much fun, and then we get lots and lots of questions. This one is, let's ask this one about timing in the pandemic, and then Dr. Igarashi, I want to come to you with a question about coping with your family member after that. So here's the question for now. Do you think that those who were struggling earlier in the pandemic are the same or different people from those struggling at this later point in the pandemic? Maybe related to a difference in how people handle trauma versus how they handle chronic stress. Anybody want to comment on that? Maybe variation in response as time has gone on?
We've just started looking at that a little bit. And we have longitudinal data. So we just presented on the baseline data, and we actually asked the Life Registry folks to fill out a questionnaire every week for 8 weeks. And the interesting thing was that almost all of the negative stuff actually went down during those first few weeks. But at the very end, it started going up again. And I wish we had, been able to keep collecting data, but it's a burden on people to keep filling out these surveys. But my guess is that for a lot of people, things have gotten worse, or and the next thing we want to do is look at patterns. There are ways of doing this statistically, so you can figure out, whose depression got worse, whose depression got better, whose depression got better and then got worse, and then we'll be able to look at that. But it's a good question. It's a great question.
Great question.
Thank you all for that. Let's go to a question in the chat, and this one maybe I also want to think about sort of our own self-care for the three of you. You study stress and personality and coping and resilience and how to age well, and so I want to be sure that folks in our audience get your wisdom. But I do want to start with you, Heidi, because we've got a question in the chat that's asking about how you are able to care for your family member who has vascular dementia, and sort of, yeah, you know, that's not an easy thing. So maybe you could tell us how you manage your own well-being and self-care, and then we'll come to Carolyn and Karen as well.
Okay. Yeah, thank you for that question, for whoever asked that, because it's a very, well, I'll just explain. My mother is now 95, and she has been living with us. And it's interesting. I used to say to my husband that he had to keep working. He couldn't retire because working meant he was out of the house, right? But then the pandemic happened, the lockdown happened, and we were all three here, right? And my mother is a lovely person, but not always the easiest person. And so I wondered how it would go. And so some interesting things, it went really fabulously well. And it was easier to take care of her with him here, actually. In non-COVID times, what we did and what I would strongly recommend is that you need an army of support if you can. For myself, we use the Grace Center, which is an adult day service, and I also hired private caregivers. In COVID time, places like the Grace Center were also on lockdown. They were shut down. We've been closed for over a year, now barely getting back very limited numbers of being allowed to get very limited numbers of participants. So I think for people who, I think it's been very tough. And when, before the vaccines, when you felt fearful about letting anybody in your home, or then I think people felt very isolated. And so for those of you who are out there who have been doing caregiving all by yourself this year, it's been very tough. And I think that with the vaccines, maybe it's safe to, with COVID testing, to allow caregivers to come back in, to allow your care recipient to maybe receive some services.
Thanks, Heidi. I appreciate the working your support system, right? Making sure you have one and that you're using it. Karen, thoughts to add on how we care for
say
ourselves?
that I appreciated the question that came through beforehand about getting a break if you're caregiving and you don't have the luxury really to get away. And I would say it is super important to take care of yourself, because you're that link for whoever you're giving care to. If you're not doing well, a lot of research has shown that that's really bad for the care recipient. So even if, of course, you should do it for yourself, but also for your loved one, you should do it for him or her as well. I would say find ways to take micro breaks throughout the day. Even 5 minutes is, space throughout the day is, I think, a good thing. And you can just do things like, well, a lot of the things that Carolyn and Heidi were telling us about in terms of breathing. Maybe go hydrate, drink a full glass of water, stretch, do 10 jumping jacks, walk outside. And maybe you can't leave your loved one, but you can at least walk right outside, leave the door open or whatever, and make sure that you can still see them. But do something to take a break. Micro breaks are, over time, can really add up to quite a stress reliever. Watch a funny video.
Yeah, I was going to say humor, watch a funny video. I've actually found watching like old movies, that are comforting. They're not stressful. They're not, shoot 'em up, bang, bang, always, that fun. And music is actually a really important stress reliever. And different sorts of music, may work better than others, but something you enjoy. So to take care of yourself a little bit, because Karen's absolutely right. If something happens to you, it's going to be terrible for the person you're taking care of. And so you have to figure out how to negotiate with the person you're taking care of to understand that it's in many ways is a reciprocal relationship, that it's not just you taking care of everyone, but they're having an effect on you as well. And especially in later life, when you have older couples taking care of each other, it's very hard to say who's the caregiver and who's the care recipient because they're both helping each other. And if you can possibly foster that, it's not easy a lot of times, but that would be great. Okay, thank you.
You all, we've done it. I'm looking at my list of questions from the registrants, and I'm feeling like, especially by talking about micro breaks, we have covered a lot of these ideas on, working parents who are juggling kids, advice for caregivers who don't have the luxury to take breaks. I think, are there parting words from you all, wise panelists, action items, next steps, sort of one last tip that you'd like to offer to our audience before we turn it back over to Casey?
Maybe just, I would reiterate, I think what Heidi said in terms of social support. I find myself, and this kind of links to the question about timing. At the beginning of the pandemic, we were in Zoom calls with friends all the time and now I think we all sort of have Zoom fatigue. And I'm like, oh, I don't really want to do another Zoom call, but find some way still to reach out and keep those connections strong.
Thank you, Karen. Other closing thoughts?
One of the things that we came up with in the study that Heidi and I just published was that resilience is a two-way street, that community resilience depends upon the resilience of the individuals, but having a resilient community can also help individuals. So please, 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 if you haven't gotten vaccinated, get vaccinated. Because if we're all vaccinated, then we can go back to, shopping and going out to dinner and movies and, watching the Beavers, lose again. No, don't win at baseball, right? So that if we can be individually healthy, we'll make our community healthy, and that will open everything up again. And then we can all get back to our lives, which would be wonderful.
So to follow on that, I'd just like to say that thanks to the vaccine, thanks to abundant testing, I can bring caregivers back into our home. I can, we can get that kind of social support that caregivers need, and our care recipients need. I'm sure my mother would like to see other people other than us. So anyway, thank you for this opportunity.
You all, thank you so much. This has been really helpful. And I just love all of the tips that we've sent. For those of you in attendance, Casey always sends a follow-up email. I'll let him tell you about that. But don't forget the life registry that you can find at the Center for Healthy Aging Research if you'd like to be a part of that. And again, special thanks to our panelists, and please get in touch with us at the College of Public Health and Human Sciences if you'd like. We'd love to hear from you.
Thank you, Allison. Thank you, panelists. Amazing, amazing episode. Really, really appreciate it. Again, a lot of work that these three individuals have done as separately together can always be found. health.oregonstate.edu. There's a lot of incredible work being done. We always recommend you head on out to the College of Public Health and Human Sciences website to find out more. So again, thank you to you as well for participating today. Today was the second episode of our fourth season of the Public Health Insider. Our next episode, mark your calendars now, even better yet, go to our website and register for the last episode of this season, which will be on Monday, May 17th at 4 p.m., titled Healthy Back Home. It's about ergonomics and the importance of having that in and around your home, not just your home office, but around your home. And you can register for this website, go to osualum.com/public health webcasts.